Hello, everyone. How are you doing? Emmy here. I hope you're having a great day today. Welcome to another Purposeful Conversations here in the PAMI Code Facebook group with me, Emmy. And today we're actually joined by a wonderful trainer, speaker, and host of the Mental Health Revolution podcast. She's passionate about demedicalizing mental distress, and we're here to talk about positive mind management and how can we use positive mind management to help us manage our well-being. So without further ado, let's all welcome today Kate Ashley Norman. Hi Kate, thanks for
Good
joining
morning.
us.
Hello. Thank you. Thank you for having me.
Well, I'm really interested with what you have to say about demedicalizing mental distress, because I'm a psychologist myself,
Mhm.
and in fact I'm a critical psychologist who's actually into challenging um common practices on how we treat and how we conceptualize mental distress. So what is your take on this, and why are you so passionate about demedicalizing it?
It's interesting, isn't it? Because I'm not a psychologist. I'm a very, very normal human being who has emotional and mental issues every single day of my life. And I think everybody does. And the mere fact that when we start to medicalize these normal human emotions, what it does is it takes away from the human aspect of it. So, if you're feeling sad or if you're feeling happy, if you're feeling frightened or stressed or any of these things, I think by medicalizing it, we are almost teaching people to be frightened of them and that we shouldn't be experiencing these extremes of emotions, which I think in itself adds and contributes to making these emotions even more harmful for you. So I think it's more about accepting that we are all human beings and that we all have these emotions, we have these feelings, and actually what we need to be doing is actually understanding them better, accepting them for what they are, understanding why we feel the way that we feel, and then actually using them to move forward instead of kind of hiding away from them.
Yeah, and I think you are absolutely right. When it comes to the medicalization of psychological distress or mental health generally, it adds to the stigma that
Yeah,
you're
absolutely.
associating certain levels when you feel a certain way, when it's actually part of the human experience. It's
Mhm.
not to say that we have to just if you're feeling depressed or
Mm.
anxious, that
Mm.
it's okay to feel that way
Yeah.
sometimes without judgment, without any stigma. But we also need to learn how to cope with it
Yeah.
when we experience it. It's almost like when you catch a cold.
Hmm.
um it happens,
Yeah.
and but you need to know how to manage it so you can actually get on with what you need to do.
Yeah.
What do you have to say about the ones who experience, for example, bipolar disorder, schizophrenia, the ones that you would label psychiatric
Hmm.
disorders? Are you differentiating that from just a mental health distress, psychological distress, compared to those
Yeah.
with more chronic
Yeah.
psychiatric conditions?
Yeah. I think mental health as a whole is a sliding scale. So the further you go, the more extreme it feels. Now, things like now, I'm not an expert on bipolar or schizophrenia for in any way whatsoever. And I think that the people who suffer from those kinds of conditions are in a very, very difficult situation. However, I think that they can be managed. The situation that they are in is able to be managed in a much more empowering way than
Mm.
just labeling it as a disease and treating it with pharmaceuticals
Yes,
as the
absolutely.
solution. So, um, I mean, I have been sort of accused of being anti-pharmaceutical, which although I'm not totally, I think that it has its place in situations like that. Um, I think that the overuse of medicalization doesn't help, or the overuse of pharmaceuticals does not help. And I think it is far more effective to actually treat it on in terms of taking into account the environment that people are in, the culture that they have been brought in and that they operate in, the society that they are in. There are so many different levels that all contribute to what is quite often a descent into extreme mental distress, as opposed to, you don't just wake up one day and go from being a happy person to somebody who
There are
has schizophrenia.
triggers. Yeah.
There are triggers, and it's like a descent. There's a definite pathway that people go through to get to that state. And I think that by obviously, once somebody's in that state, it's different, but we can stop people going down that path by understanding our emotions better, understanding how we react to our emotions within the environment that we are in.
I absolutely agree, and to be perfectly honest with you, I've been clinically depressed at some point, and I was advised to take medication, to help manage my symptoms. But I refuse to take medicine. I refuse to take some drugs because I really want to understand where the emotions are coming from. What are the triggers? What's about, what's in the environment that's causing me to feel this way, and how am I responding? How can I effectively manage the triggers if I'm not able to escape from the triggers? The triggers will always come. This is life. But by taking medication, it's almost like I'm putting Band-Aid, and I will just keep getting poked, by the triggers if I don't understand what the triggers are and how I'm responding to the triggers. So it is possible that medicating can make it worse, because you're just hiding away and trying to numb yourself from the triggers, when actually it would be far more empowering to understand your emotions, to understand what's causing you to feel this way, to understand your reactions, rather than just to numb yourself, or just to manage it. Although I have to say, there are people where medication help because they couldn't really understand what's going on anymore if they don't calm themselves down. So there are advantages and disadvantages, but for me personally, maybe it would have helped me if I took medication. But I refuse to, because I want to address it in such a way that I want to understand how I'm feeling, why I'm feeling this way, what's causing it, and how I'm responding to it. So the next time I get triggered, I know that that's a trigger, and I can modify my reaction and my behavior in a certain way. So, that for me was more empowering than taking medication.
Absolutely. Well, the thing is, we all live in a world which is tough. We all, we have to operate, we have to work to earn a living, we have children, we have partnerships, we have relationships. We all live in this very highly complex world that we have to deal with, and we can't control everything. And I think that with these, when we talk about triggers, if we like constantly on the lookout for all these triggers as well, in order not to be triggered into depression or whatever, then we are constantly living in a state of fear. And actually what we need to be doing is building up that resilience so that we're not living in that state of fear, so that if something happens, which maybe previously would have been a trigger, then actually we feel confident enough and resilient enough in our own abilities to power through whatever that is and come out the other end.
Yeah, that's absolutely right. Building the resilience, and at the same time, also accepting that it happens. Like, you don't have to be strong all the time. You don't have to be happy and to be positive all the time. If you're having down moments, it's okay. You,
Yeah.
you will recover eventually, but
Mm.
it's okay to feel that way sometimes. And
Mm-hmm.
if you have people who are compassionate and who knows that, okay, you're having, not, not such a good state today, it will pass. What
Mm-hmm.
can I do to help you, to listen to you, not to judge, you know what I mean?
Yeah.
So
Yeah.
it's also embracing the fact that we will have our ups and downs. You don't have to
Mm-hmm.
be strong all the time. You
Mm-hmm.
can have days where you are feeling down, and it's okay. It's part of our human experience.
Absolutely.
And
Absolutely.
I
Yeah.
don't know, have you seen that movie where the different emotions in I forgot. It's
Oh,
an
the
anime.
inside. Is it Inside
Inside
Out?
Out,
Yeah.
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 Yeah,
Yeah.
I found that, it was quite fascinating as a
Mm-hmm.
psychologist watching it. How complex emotions can be, that you can be
Mm.
happy and sad at the same
Yeah.
time.
Yeah.
It's quite interesting, and it's
Yeah.
actually okay. It's all part of the
It makes
human
us who we are.
experience. Exactly,
Yeah.
exactly. So tell me a little bit about this positive mind management. What is it, and how does it help people?
Well, I'm trying to create, or I'm creating this platform whereby it's kind of like a constant reminder that actually everything's going to be okay. So it's a platform which is bringing together everything that I kind of have learned and read and understood and just know to be pure and utter common sense, if you like, about understanding emotions. Learning about emotions, understanding them, um, leveraging them for good as well, um, touching on sort of common mental distress issues like depression, anxiety, that kind of thing, giving people a much deeper insight into what they actually are, what they mean, why we need to embrace them as opposed to be frightened of them, all that kind of thing. So it's very much a learning platform. And I've kind of uh, want to sort of just give people that I want to create a common sense approach to our mental well-being, if you like,
Right. So
which is
it's an online learning
it's
platform, or is it
yeah
a community, or do they?
it's an online it's a platform. There is a community that I'm building as well within Facebook, but the actual foundation of the program is just an online platform that people can dip in and out of. It's drip fed over a period of 6 to 12 months. So
Right.
always there for people. It's like it's just there for people when they're struggling, that they can go into it. It reminds them like every week, every few days, that they need to be thinking about their mental health in a different way, just rethinking the way that they respond to things, all that kind of thing. So it's a very easy to use uh, resource that people can dip into when they need it, when they need to understand a little bit more about themselves, maybe why they're responding in a certain way, helping them to maybe change the way that they respond, that kind of thing.
Right. And there are strategies that you teach in there, and
Yeah.
like prompts that they can apply in their activities.
Yeah, absolutely. So it's full of like just little things that they can do to be changing on a constant, on a constant basis. The thing is, it's based on the idea that uh, mental distress and mental health problems are the result of a compounding of different things that happen
Factors.
over course of time. So what I'm trying to do with positive mind management is to reverse that and start to compound them in a positive way, which is why it's not the quick fix that everybody's, most people want to have that quick fix that they go in and, within a couple of weeks they're feeling better and everything's fine. So it's not the quick fix, it's actually the complete anathema of that. It's about just slowly but gently, embedded within your day, you are making little changes bit by bit over the course of several months. And then you realize that actually the person that you were then and the person that you are now is actually completely different. So it's almost it's encouraging people to change without realizing that they're changing almost.
Yes,
Does that
yes.
make sense?
So it's more gradual. And
Yeah.
is this do you have like a particular group of people? Is this for women? Is this for business people? Is this, or I'm assuming this is not for people with clinical. I
No,
know
no.
that you're into
Yeah,
demedicalizing, but
yeah.
it's not for those who have been diagnosed with clinical conditions.
No, no, it's not. It's not, but it wouldn't do them any harm.
Mm,
Put it that way. It wouldn't do them any harm. No, I mean it's. I know it's probably quite fashionable these days for people to say, "Oh, well, I help women, do this, that, and the other." Do you know what? It's for everybody. It
mm,
is actually for everybody. I probably have created it better for people like myself, for maybe women and men of a certain age who have got jobs and responsibilities and businesses. And I'm a business person myself. So that's the language that I talk about. That's the
yeah.
language that I use. So it's probably more aimed at them purely
So
because that's the
do you
language that I
teach
use.
something around managing your environment, or what sort of techniques, or yeah, what things do you recommend in your in that program to help people manage their psychological and mental health?
Uh, well, it's about understanding it's really about understanding how they tick, isn't it? Ultimately, so it's about understanding um, uh, the relationships that you have and the way that you respond to
Mm,
relationships. It's about understanding, like you mentioned just then, about the environment that you're in, and about accepting the things that you can and can't
mm,
control, and building up your own confidence in your own ability to cope with the challenges that you might face on a day-to-day basis, or at various points through your life. So it's about building up um, your own inner strength, if you like. So having that confidence and that ability within yourself. Um, so it's like taking all the sort of almost like different components to who you are as a person, um, not changing you in any way, but
mm.
just my
Making
by
you more aware.
yeah, making you more aware and bringing the best out in you. I think
Right.
I think it's the
I
thing.
understand that, because when you actually when you are more aware of how you feel, or your
Mm,
thinking process, and also the factors that affect you externally, and how
yeah,
you're responding to people around you, to
yeah,
circumstances, and to
hmm,
your environment. It's that interaction between what's going on in your head,
yeah,
and how you feel,
hmm,
and how you respond to the environment that you're in. So
mm,
I think it's good that you have these this platform that will enable them to reflect, to
yeah,
think about how they are thinking, how they
hmm,
are feeling, and how they are responding
hmm,
to people around them, and to the environment and the context, and so
yeah,
on. So I think that's
yeah.
absolutely fantastic.
Hmm.
So Kate, if people want to reach out and to know more about you, where can they find you?
Well, I'm on Facebook. I'm on Instagram. I'm on LinkedIn. I'm quite active on the social media, and there's not many Kate Ashley Normans around, so so I'm
I've
very happy for
noticed.
people to reach out to me direct, and then I can sort of hook up.
So they can just search Kate Ashley Norman
Yeah,
on Facebook, LinkedIn, Instagram, and
Instagram, LinkedIn. I'm on LinkedIn, and if you just Google Kate Ashley Norman, it normally comes up with me as well. So
yes, and you have a podcast as well called
I
Mental
do,
Health Revolution. So is
I do,
that,
yeah.
they just Google that or search on
They
iTunes?
can find that as well. Yeah, they just they can just Google that. It should come up. So
Fantastic. Thank you very much for joining us today,
thank you.
Kate. And folks, yeah, that was quite an interesting conversation about the medicalizing, psychological and mental health. For me, in my profession as a psychologist, well, I'm actually a critical psychologist. It's almost like a rebel psychologist. But we've always had this talk around demedicalizing mental health. Being more open about mental health, and not always. I know that there are pros and cons about taking medication, but really, it's important to enable people to understand their emotions, to understand their environment and how they respond to their environment and the people around them. It's more empowering that way, rather than just popping pills all the
Mm.
time. But, as I've said, there are pros and cons, but I'm all up for, really embracing mental health, having conversations about mental health, and having this sense of awareness that, yeah, it's part of our human experience, and it's okay not to be okay sometimes.
Mhm.
All right, so that's it. Thanks everyone for joining us, and we'll catch up again next time for another purposeful conversations with Emmy here in the Pami Code Facebook group. Until then, take care everyone, and bye for now. Bye.